Self-care? I think that is selfish. I'm a wife, a mother of 6, and also ICU resident at Sunway Medical Centre. My job is very demanding physically and emotionally. I always question myself whether I'm doing enough for everybody or not. Before my second child, I even questioned myself whether I could love her enough as much as I love my first child. Well, I was so wrong. Right now, I have 6 beautiful children and love multiplies. Life is a beautiful chaos. I'm Dr Halina Mohd Yunos, and this is my story.
It's 2022. Half the population are women, and yet so many of us are uncomfortable discussing the truth about our bodies, how they work and how they don't. And that's why we're celebrating Her Stories, a special series that explores the physical, emotional, psychological, and social forces that influence female bodies and how we can strive for better health and happiness. We'll be interviewing amazing real women who have gone through life-changing obstacles. This special series was brought to you by Sunway Medical Centre in conjunction with International Women's Day. I'm your host, Cheryl Samad, and today with me I have the delightful, esteemed Dr. Halina Mohd Yunos, who is an ICU resident at Sunway Medical Centre, who is also married to astronaut, restaurateur, author, pediatrician, and now author Dr. Sheikh Muszaphar Shukor. And together they have 6 beautiful children. Now, Doctor,
Yes,
welcome.
Thank you, Cheryl. Thank you very much.
Now, don't mind the pun, but that is an astronomically huge feat. 6 children?
Yes, that's
How?
a lot. Actually, we aim for 10.
No.
Yes, yes, 10 children.
Okay.
But we got married late because of work commitment and
Right.
everything. So, well, age is catching up.
Yes.
So, we'll see how it goes.
Yes, you still have time.
Yeah, I still have time.
Now, in the age of self-care, right? You're working in the ICU, which
Yeah.
I imagine is can be stressful. You're thinking a lot. You're always on your feet, and then you have 6 children to care for. So, when it comes to self-care, what does that mean to you as a career mom, and how do you feel about it in general?
Okay, to be honest, to divide myself into, like at work, we have to work.
Yes.
We have to give full attention to patients at the hospital.
Sure.
And then at home, there's like these 6 little kids, mommy, everything.
yes.
So it's actually very demanding. Actually, I feel that self-care is very selfish.
You do?
Yeah?
Okay.
Yeah. I guess it's not just me. All mothers feel like that. They
Sure.
always want to give. But at the end, they themselves, they feel tired and burn out. So, it's very important for us to find time, like just a little time, 5 minutes or 10 minutes in a day, just to make time for ourselves.
That's right.
Yeah.
When you say like mothers burn out, was there ever a moment in your life with children as a career mom that you felt that you were losing your sense of self?
Well, I feel that on a daily basis. Whenever I feel like upset with my children, I take a break. I get away from the scene. If let's say they're fighting,
Yes.
I just walk away for a while, take a breather, just 5 minutes, take deep breath in and out. Tell myself they're just kids, they're just being kids.
Right.
It's okay for them
Yes,
to fight. It's
yeah.
okay for them to make mess.
Yeah, I have that place too. It's my laundry room.
Oh,
5
mine
minutes.
is in the toilet.
Oh, really?
Yes.
How do you handle co-parenting with your husband? What are the rules of engagement there?
We always make sure there's one person, either me or my husband at home. So I have to be at work almost every day, and he has more flexible time. So whenever I'm at work, he'll be at home.
Okay.
Or when he has to travel, I will take leave or just find time to be at home.
Okay,
But
that's
one
nice.
of us has to be with the kids at home.
I think that's a good rule to have. Women are very important in the workforce.
Yes.
But these days, maybe because of motherhood or raising a family, a lot of mothers, a lot of women are stepping back from the workforce, and some not even daring enter it at all. But for you, how do you balance your career, your children, and yourself actually?
Well, for me, family comes first.
Sure.
Okay, work is also important. We need to have a sense of belonging, not just at home, but something that we have on our own. I think work is a place where I can be myself. At home, I have to sacrifice everything. Like my time and my attention. Everything has to go to them.
And also, like when you go out and you do what you do best, and you come home, you
Yes.
just become a better parent.
Yes, true.
Right?
Because I like working in at hospital. That's my passion. So
Yes.
when I come home, I feel satisfied and I feel happy of what I did at work.
Correct.
So,
You just feel fulfilled and content,
Yes,
right?
true.
And you're in a good place.
Yes.
So family always comes first.
Yes.
So Dr. Halina, you have 2 sets of twins.
Yes, Cheryl. I'm very lucky.
You are. You really are. And your last set of twins were born during the pandemic.
Yes.
And there's a lot of anxiety and stress for pregnant women, about getting pregnant during the pandemic.
Yes.
Were you worried at all, or were you just extremely overcome with delight?
Well, of course we were so... that was a good news for us because we were aiming for 10, remember?
Yes, I remember.
But it was during the pandemic. We know for a fact that pregnant lady, their immune system is lower, and then it's very dangerous. If they contract COVID-19, the implication is worse than normal people, the non-pregnant ones, okay? So, yes, I was so worried, but at the same time, I go to the hospital and they always make sure the hospital is clean, the environment is clean, they always sanitize the lift, like all the railings, they sanitize it every 2 hours. So at some point, I think that hospital probably is the most clean place I can ever go to. So I feel safe in the hospital.
Can a fully vaccinated mother pass on her COVID-19 immunity to her baby through breastfeeding?
Yes, the answer is yes.
Really?
Yeah, there are a few studies that shows that a mother, fully vaccinated or even post-COVID mother can pass the immunity to their baby through breastfeeding. Yes.
That's amazing!
I know.
Have you ever experienced any difficulties conceiving? Because it seems to me like you are very fortunate to have 6 kids quite easily.
Well, because I had 2 pairs of twins, you see.
Right,
so that's
yes.
like buy one, free one deal. Yeah.
Exactly, yeah.
But I had my miscarriage too.
Right,
Because of work, there's one time I was in ICU, we were doing rounds and we had to do CPR, and I had miscarriage immediately after we did the CPR. So that wasn't easy, But I guess it's God has better plan for us. Yeah.
Yes, I'm sorry to hear about your miscarriage. And the thing about miscarriage is that when a woman experiences a miscarriage, there's a lot of shame and stigma attached to it, and she doesn't want to discuss it, because she feels like, in a way, she's failed as a woman.
Yes, true, yes.
But what
I know how it feels like,
I know people who have it, but what would your advice be to someone who's going through that now?
I believe a strong support system is very important.
Yes.
For me, like my girlfriends, they are always, they're always there for me. We always talk about things, because once you have miscarriage, especially when you have miscarriage over and over again, you feel inadequate. You feel like you fail to function as a mother, as a woman. So talk to your friends, talk to your doctor, whoever that makes you comfortable. Sometimes it's difficult to talk to your husband because both of you are
Have
hoping.
suffered it as
yes,
well.
both of you actually are grieving. So talk to somebody who is not in the same boat. So to be honest, I find it difficult to talk to my husband because I know he's also sad, in a way. So I just I talk to my girlfriends. I think that is easier.
A neutral party.
Yes, neutral party. Yes.
Yes, exactly. When it comes to family planning, Dr. Halina, whether you want to have a big family, a small family, a family now, a family in the future, or after or if you're planning after suffering a loss, what is the role of the doctor in terms of helping a couple cope with it and to move forward? You, as a couple, you have to talk to your gynae because they are the one who will guide you. They know the hormone imbalance, the body physiological changes after pregnancy, when to get pregnant again. Of course, they know better. Sure. So you talk to them, tell them what's your plan, and they will help you to plan. Thank you so much, Dr. Halina, for your time. I know how busy you are.
Thank you for having me.
And I must also say that when I look at photos or videos of your children and you as well, I just get the sense that it's such a happy, loving, chaotic.
It is super chaotic, yes, but I love it.
I'm sure you do. And it just proves that happy, healthy children are the result of happy, healthy parents.
Yes,
right?
true.
And it proves to me that taking care of yourself and mentally and physically, self-care is very important for you in order for you to be a good parent.
Yes, true.
Right? So thank you once again.
Thank you.
For any one of you out there who would love to share your story, then please do so on #SunMedHerStories, and you never know if you could be helping someone else who's watching. For more information on women's health and also our guest on the show, then do go into our website. See you in the next video. Bye!